Mishka, the sea otter, knows nothing about wildfires, but she did learn what it's like to have trouble breathing when the smoke got thick.
These lungs here, you can see just have a little more white in them. And usually in a normal radiograph of a sea otter, you wouldn't be able to see those things.
Lasana Lahner diagnosed Mishka with asthma, the first case they've ever seen among sea otters.
Right here, baby. Good.
Now Mishka needs to learn how to use an inhaler, just like humans.
We want to make this as fun as possible. So any kind of medical behavior that you're training, you want to make sure it's nice and positive.
Her trainer, Sarah Perry, uses food to teach Mishka to push her nose on the inhaler and take a deep breath.
Good.
Mishka's medicine is exactly the same as what's in a human inhaler, but she may have something else in common with humans.
More and more, there starts to be this concept of what we're calling One Health, which is really that there's a connection between the health of people and the health of other species, and that sometimes those species can be telling us that there's a problem in the environment.
Dr. Peter Rabinowitz is a professor at the University of Washington. Human cases of asthma are up by about 25% over the last decade.
Good.
The health of sea otters dates back to their extinction in Washington. 40 years ago, Alaskan sea otters were brought south and reintroduced on the coast.
So anytime that happens and reduces the genetic diversity of a species, that can affect their immune system and their ability to fight off diseases or deal with different environmental contaminants.
It means animals like Mishka can have heightened sensitivities that alert to environmental changes. Only about a year old, Mishka will likely need the inhaler for the rest of her life.
Good. That a girl. Good girl, Mishka.